guys are like, what is feldspathic porcelain and when should I use it? Well, hopefully with this video, I'll be able to answer those questions. This is feldspathic porcelain the way to go? Casually explained. There I am, waving at you guys. Aren't I so cute? So you have this patient. Let's call her LaFonda Wong. LaFonda, or what I like to call her, Fonda, or even Fondue sometimes, comes to you with wanting to reposition her anterior teeth and color match the anterior teeth to her posteriors. As always, I go to consult the highest and most knowledgeable person on the topic, my mom. So I call her. Hey mom. Hello, sweetie. Have you been changing your underwear? Yeah, I've been flipping it 4 times like Dad told me. Anyways, I have this patient who wants to reposition her anterior teeth and color match them with her posteriors. What should I do? Oh, I know. Types on Google search, clicks on Wikipedia link, then clicks on the WebMD link located within the Wikipedia page. You should do veneers with feldspathic porcelain. And wait, hold on. According to this website, seems like she might have cancer too. So is feldspathic porcelain the way to go? Yeah, you really are unsure here. Though my mom has a profession very closely related to dentistry, she's an accountant. Knows everything and uses very valid sources. She's kinda crazy and slightly dyslexic, so you really don't know if she's right on this one. So you go to the next best option, your classmates. You stroll up to your classmates and you're like, hey friends, I have a patient who wants to reposition her anterior teeth and color match them with the posteriors. What should I do? Student 1. Feldspathic porcelain, bro. You already know. The preparation is really conservative and she has a lot of enamel to bond to. Student 2. Yeah, what he said. Student 3. Yeah, it works. For real though. Student 4. Dead silent. Student 5. 15 minutes later. Hi, guys. So, is feldspathic porcelain the way to go? Yeah, you still really are unsure here, though student 3 does have a point, but especially student 4, we really aren't too convinced. There are too many variables. Like, student 2 didn't really sound very assuring, and, well, student 1 is student 1. So you have to go to the people who know how to handle their materials, the dental techs. So I strolled up to the dental techs, acting like I know what I'm doing, as usual. And I'm like, hi, Miss S. Can you do this patient for me? And Miss S is like, oh my gosh, you're so funny. Haha. No. Aw. Anyways, I was wanting to reposition my patient's anterior teeth and match colors to her posterior teeth. Miss D, I think feldspathic porcelain would be an excellent choice, especially for veneers on anteriors, because it has the best aesthetics out of all the porcelains. So for the third time, is feldspathic porcelain the way to go? Yeah, you're still very unsure here. Miss D is a Seahawks fan, judging by her lanyard, and everybody knows you can't really trust a Seahawks fan. And also, Miss S was probably too fixated on her Bass shoe collection. And you're waxed up in that one class that didn't really have a grade for it. Plus, they have been both working with materials that let off fume, and it's probably getting to their head by now. So it's really best to take their thoughts very lightly. As more and more time went on, I had to quickly think of someone to call for help. Ghostbusters? Nah, but there was one more place I could go. Hey, Dr. Garcia, long time no see. I was wondering if you could help me with this patient I had. She wants to reposition her anterior teeth and match the color to her posterior teeth. So for this case, the centrals are like the twins, and the laterals are like the brothers, and the canines are like the sisters. Are you following? Yes. So the sisters hate the brothers, and the brothers hate the twins, and the twins like everyone, so the sisters have to hate the twins as well. Are you following this? Due to my extremely great critical thinking skills, I knew the perfect response to show my attentiveness. Kind of like keeping up with the Kardashians? Ah, so glad you are listening. So anyways, what material should I use? Feldspathic porcelain. Why would you think anything else? It has the best aesthetics. It's very conservative. There's a lot of enamel to bond to. Looking at her health and dental history, doesn't seem like she has any contraindications. I think all signs point towards feldspathic veneers. Ah, I see. So where do I sign? Where did you come from, you extremely handsome professor? Also, wait, this isn't really a lab exercise, so there's not really anything to sign. This is like an actual, you know what? You can sign right here. Signs the paper. Thanks, Doctor, Professor, Mister. You betcha. So, is feldspathic porcelain the way to go? Yeah, you still really aren't sure here because Dr. Garcia is a troll sometimes and likes to test your knowledge, so this could all just be one big test. You would also ask for a second opinion in this situation, but the faculty member you want to ask is probably at Disneyland again, according to his Sakai page. Then I realized I totally forgot. I was seeing the patient from this morning, so she's been waiting in the chair for about the whole day now, and I'm sure she would like to get the appointment over with. I rushed into the operatory, sweating and panting. Oh man, that flight of stairs doesn't get any easier from floor 10 to 9. Where were you? I've been waiting here for 7 hours. I was taking care of some business, ma'am. Sorry for making you wait so long. So, the information I have gathered has pretty much been useless. But if you would like to hear it, I'll explain it now. The general consensus is that we make feldspathic porcelain veneers for the following reasons. Wah, 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 wah. Does this sound good to you? Yes, just give me the feldspathic porcelain veneers. Is feldspathic porcelain the way to go? Yeah, you are absolutely still unsure here. The patient had some hesitation and a little bit of resentment in her voice, so she could be very uncertain on what she wants. But you go with the feldspathic porcelain anyways. And the results? She completely loves them. So, all in all, was feldspathic porcelain the way to go? Yeah, in the end, you are still uncertain, unfortunately. The patient could be Canadian and just being nice. Well, that's it. That's the wrap up. That's the end of the story. Hopefully, this clears the air about this topic and you slightly have a better understanding of feldspathic porcelain. Either that or you come out with the understanding that you should always be questioning everyone, especially your mom.